Bismillahirrahmanirrahim, dear audience, listeners, students, peers, mentors, teachers, learners. Today, we will discuss the adoptive leadership, which is one of the relatively new theory of leadership. In fact, if you remember, we discussed last time the change management and the process, which is normally in the change process, and the cycle which we anticipate with the change management. And then we also discuss various strategies during these various phases of change management process. Just to reconnect what we have been doing last time, the change management is basically a process through which you would like to move from one state to the other state. Now, the change management is inevitable in the wake of modern technologies, globalization, and now in the context of the epidemics and pandemics, even the change management becomes more imperative and inevitable. And certainly, once this menace of the COVID-19 is over, certainly the world would like to adjust to many social and economic shocks. And by and large, this is thought to be the Great Depression, economic depressions in the last almost 100 years. Now, the social scientists, the demographics, the health experts, the health scientists, the economists, and the international experts are trying to analyze the impact of this coronavirus in multiple dimensions, but of course, on its impact on the sustainable development of the world, its impact on the social landscape of the world, and above all, its impact on the economy, both micro and macro economy, because one of the biggest dent in the economy is by virtue of non-utilization of the millions of workforce and human resource, which has been constrained and locked down at their homes. At the same time, the health services around the world are under high pressures, and the capacity of the healthcare is highly threatened around the world. Because in most of the cases, the capacity has been overwhelmed by the patients and the infections, the infected patients. So healthcare emergency is at the moment one of the biggest challenge. And then certainly once it is subsided within the next 2 to 3 months, then the next very uphill task would be the social, very important rehabilitation of the people and the rehabilitation of the economy. We discussed in the change management that whenever a change process is started, there is always a phase where the people would deny this change and people would not to come to this change. And then the leaders would try to convince them, and there would be need for a very high level of communication, understanding on both sides. And then maybe the motivation level is very low at the beginning, and the people may resist sometimes the change which you normally bring as a leader. And then that is followed by exploration that you would try to make some people with you who can be understanding your viewpoint, and finally you go for some kind of commitment from your team. And now the adoptive leadership, which is a leadership style which is more accustomed to the changes around, because the dynamic nature of the world and organizations and the complexity of tasks require the leaders to be highly dynamic and adaptive. So this need for a new style of management was realized by the experts towards the end of last century. And by that means it is one of the earliest, latest theory of leadership. And the credit of this theory goes to quite few people like Riffords, Sender, Greshow, Laurie, and Lenski. So it emerged largely from the work of Eves and his associates, and I described their names. Adaptive leadership is the practice of mobilizing people to take tough challenges and thrive. So the challenges and the nature of challenges we discussed last time, which may come from the globalization, from pandemics, from technological innovations, from new emerging technologies, from the productivity related issues, from the quality competition, from different emerging challenges would always bring some tough tasks ahead for the leaders. And it would be definitely a top priority of the leaders to adopt these changes. And to achieve this, the leaders will mobilize, motivate, organize, orient, and focus the attention of others. So the activities which the adoptive leaders would tackle is to mobilize the resources. And this is one of the very difficult challenge, because the resources are not at the same level of understanding and learning. The resources are not equally leveled. The resources are not equally competent. Some, and very few of them, will be having very high competency in terms of human resource. And if we talk about other resources, even the other resources may not be available to the optimal level. Then you once mobilize the resources, you will need to consistently motivate your team and the people around who are working with you. And then you try to organize them in a way that they can be thought as a team. And then you train them, orient them, and you develop their capacity. And then finally, you focus their attention on the goals. So the process of this adoptive leadership is certainly holistic, because it takes the changing and the dynamics around us is the base for adaptation or adoption to these changes. The goal of adoptive leadership is to encourage people to change and to learn new ways of living so that they may do well and grow. Now, this is really very important, because when we come across the various segments of society and the various challenges in the society, most of the time we believe that our teams would need to adapt to these changes. And so the leaders must have a very close eyes on the changes around, and then develop, motivate their followers and team members to adapt to these changes. Conceptually, the process of adaptive leadership incorporates ideas from 4 different viewpoints. This is very important. The systems, that there will be different kinds of system working within the organization. They might be subsystems and system, different, for example, financial management system, project management system, human resource management system, the student services system, and all these together will combined make the organization. So organization will have system and then subsystems, and down the subsystem we will have some rules and then some authorities, and then at the bottom we have the resources. The biological would certainly refer to the relationship of these systems with each other, just like the relationship of different cells with each other within the cell system. And then third is the orientation towards service, that the delivery and service orientation is really very important. And finally, the psychotherapy, that you may need to psychologically mentor the people when they are under high stress of change. And I'll discuss the example of, now for example, if we discuss three kinds of people, there are, for example, church membership. Over the past decade, the membership, the large traditional denomination of church in the United States is shrunken by 200,000 members, which many attribute to the denominations stand against same-sex marriage, because the church has been opposing the same-sex marriage in the United States and other parts of the world. And due to this, the church membership has gone down by 1,200 people, or 200,000. If the church wants to reverse the trend and begin to grow the church leadership, its membership need to confront the social implications of their doctrinal stand on marriage of members of the same-sex, lesbian and gay community, bisexual community, and transgender LGBT, that is the lesbians and the gays and the bisexuals and the transgenders. So this community will definitely expect some change on the stance of the. So this is a very highly adoptive challenge, that at one side the church is facing the decline in the very fast decline in the membership, and on the other hand, the doctrine of the church against the LGBT marriages is a very strong viewpoint of the church. There is another example that a mid-sized family-owned paper company merges with another similar paper company. The merger creates tensions between the employees regarding job titles, duties, different wage schedules, overtime, and vacations pay. The new owners must bring these disparate group of employees together to have their company function successfully. They will have to identify their adaptive challenges and then decide what works need to be done. So this is another example that in which the two companies have been merged. One of the companies large and the other is small, and once the small company is merged with this larger one, then definitely a lot of challenges would come across regarding their identity, their roles, their line of command and authority in all these. And there is another example of condominium, which is normally the apartment system in the United States and other parts of the world. Rules: you are a president of a small condo association, and two groups there are two groups you are dealing with. One group is the people who want that the owners must be 55 years old or older. Something it is important to have young people around, while others do not. In addition, in this area, young new homeowners are buying condos at higher rates than empty nesters. The president must guide the association to reach consensus in a way. So there is a kind of adoptive challenge, that at one hand the people normally support that the old age people must be given advantage, but unfortunately at the other hand, the young people have the money and they want to buy. So the president of the condo association is really faced with this challenge to decide about the two groups. Now we discussed the four very important aspects of the adoptive leadership by each. For example, the system perspective. Any problem which we face in the organization cannot be seen in the absence of a proper system. Definitely the problem is part of a system, and we have to see and analyze the entire system instead of just one problem. So problems are viewed as a complex with many facets, dynamic that can evolve and change and connected to other web of relationships. So there is a, just like a neural network, this is a kind of a tree, a kind of analysis in which one problem is associated with the other problem and other problems are then associated with other problem. And we have a very complex system configuration for the problems. The second is biological perspective, that people develop and evolve as a result of having to adapt of both their internal cues, state, and external environment. So this again is very important, that human being is not like a machine that just you plug into the new changes and they would adapt, or you will just program him or her in, they would adapt to the changes. Rather, they have their own internal emotions, internal cues, and external environment outside the organizations, which are forcing them to adapt to the new changes. And this we could see, for example, in the present challenge of the COVID-19, and with the lockdown has been exercised by the government. But the biggest challenge is that people, still a big number, are not adapting to these challenges because they have their own internal and external problems. The service orientation, which is very important, similar to the physicians, and adaptive leaders uses expertise or authority to serve the people by diagnosing their problem and prescribing possible solutions. The adaptive service orientation, and that's why the adaptive leadership concept has been very widely used in the service sector, and to greater extent in the healthcare center. You will see some examples that the adaptive leadership has been very successfully implemented in the healthcare and the front healthcare service. The fourth one is psychotherapy perspective, that how people accomplish adaptive work. Adaptive leaders understand the people need a supportive environment. So when the people would be going through the new changes and adaptations to the new dynamics, then definitely you would need to mentor them, and you would need to teach them, you would need to give them psychological counseling, mentoring, and this would then bring a kind of understanding amongst them. And then certainly you would try to resolve the internal conflicts, you learn the new ways and attitudes to solve the problems, and so on. Now, this is basically the model which was given by the Yeats and the contemporaries who were the proponents of this adaptive leadership. That the situational challenges may be of three types. The first is technical challenge, which is more of the routine kinds of challenges, and then technical and adaptive, which is the combination of the two. That maybe there is some routine, but a part of the challenge or a problem is not having the routine solution, and then the leaders would try to bring some innovative solutions. And then adaptive challenges, which are totally new challenges in which you don't have, for example, in this particular situation in the world, we don't have any off-the-shelf solution. Many countries are practicing various kinds of adaptive solutions. For example, I just came across one of the news that the Switzerland government has relaxed the lockdown in 3 stages, and they now similarly try to adapt to this challenge by gradually releasing and relaxing the lockdown. At the same time, we also see that in the Nordic states like Finland, they even did not impose any kind of deadlock or restriction on the movement of the people. So this was, purely an adaptive challenge, and different countries had different kinds of solutions, and based on their own wisdom and their own experience. We will discuss a bit more about these various options. Now, when we look at the leader's behavior, there can be different kinds of get on balcony, identify the adaptive challenge, regulate the distress, maintain the discipline, attention, give the workspace to the people, and protect the leadership voices from below. So these are some of the approaches in which you would like to solve the adaptive challenges, and then the adaptive work will then bring the leadership and follower interaction, and we will discuss this in the details. Now, the technical challenges we described just few moments back, that these are most of the time the routine kind of problems or challenges in which we have already some well-placed solutions. For example, if employees at a tax accounting firm are frustrated about newly adopted tax software program, the manager at the firm could assess the software issues, identify the weakness and problems with software, contact the company that provides the software and have the program modified in accordance with the accountant's need to at the tax firm. Now, this is very common because when we were bringing this online education portal, most of the faculty had problems with the management of the IT portal and IT platform, and then we, through different kinds of tutorial by the software team and the IT technical team, we tried to provide them with the solutions and the counseling. And now I feel that they are in a better position to understand. So this kind of solution, which are purely technical in nature and which can be solved through the available expertise, are not very big challenges, and you very easily adopt to this kind of challenges. The second is the sum of technical and adoptive, in which you have some part of the solution is available, but still you don't have the larger solutions. For example, if we go by the same problem of the online education, you see that though we have developed a very good technical platform and LMS system, but unfortunately at the same time we have highly problem of connectivity, in which the access of the internet to different parts of the Gilgit-Baltistan and to our student is really a challenge. And this is now a very big problem, that how can we make this LMS successfully launched. So in this case, the challenge is maybe of two types, that part of it can be understood, but part of it cannot be. The leader may act as a resource for others and provide support, but the people need to do the work. They need to learn to change and adapt. So for part of the solution, maybe for whole of the solution, the leader may try to convince and enable and empower and also develop their team members so that they can learn how they would bring the changes and solutions to the adaptive part of the problem. Now, the third is highly complex problems for which we don't have any clear-cut and easily available solution. And even the leaders themselves may not be in a position to propose some solution, readily available solutions. So they cannot be solved by leaders, authority, or expertise, or the normal ways of doing things in the organization. Adaptive challenges require that leaders encourage others with their support to define challenges, situations, and implement solutions. Now, this really would become a big challenge, because many times we, being leading the organizations, are not very clear even about the problems, and the complexity and the dynamism of the problem is so deep and wide that we don't know how to tackle the problems. And this is purely adaptive solution, in which we would like to empower some of the senior leaders of the organizations or mid-level leaders to come up with the innovative solution to solve the problems. For example, in this particular case, when we talked about the connectivity issues, we talked with the SCO, the service provider, but still we don't have the solution. So then we came up with different kinds of solution with the help of faculty, with the help of IT technical team, with the help of other peers from outside, that how can we bring some adaptive solutions to this complex problem in the Gilgit-Baltistan. An example of adaptive challenges would be the problem and concern of family confronts when placing a parent in hospice care. In hospice, there is a great deal of uncertainty for patients and families about how and when the patient will die and how to best. And this we can think about even the COVID serious patients who are on the ventilators. The problem would be that once these patients are placed in the hospice or the CCU or ICU intensive care units, then definitely it would be very difficult, because their maintenance, their provision of the vital services to them would be very big challenge. While hospice workers can give support and informal feedback about the process, for example, the patients which are in the last degree and they are likely to die within next 24 hours, these kind of, which we normally call is a highly serious patients, Now, this would be really a very great challenge because we cannot bring any solution. Rather, we have to wait for the death of such kinds of patients. So the challenge is like how the healthcare would work with these kind of the corona serious patients who are at the verge of death, how their dependents would behave. This is really a big challenge, and we could see this challenge in the attendance of the corona positive patients, and particularly the patients who were in the highly serious conditions. Even their burial and their funeral became a challenge, and there were a lot of questions in the minds of government personnel that how can we deal with this challenge. So this was typically an adoptive challenge because the problem which we witnessed in the form of coronavirus and COVID-19 was very unique in its nature, never witnessed by the world in such a great severity. Maybe in 100 years, we did not have this kind of, before the great flu pandemic of Spain flu, which happened in 1919 or 1920. So almost 100 years later, we have this kind of situation in which the highly adaptive challenges have come. So this kind of challenges, adaptive leadership is about mobilizing the patient family members to address the many questions and concerns that surround the death of the family member, versus their social workers, staff, and all these play very important roles in helping the families to cope. But at the same time, the families that have to confront the complexity and concern are of impending loss. So we could see some of the unfortunate events in a couple of weeks, that those who died of this COVID-19, their dependents and their relatives were not allowed to even join the funeral process. And this was really a, 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 a time of high emotional dilemma for these families. And even this is happening in Pakistan because very limited people, not more than 4 or 5, are allowed to be part of the funeral process. And this is where the highly adoptive challenge would come. Now, the leaders' behaviors in the adoptive challenges can be of different nature. For example, get to the balcony is a prerequisite for the other adoptive leader behaviors. Getting to the balcony is a metaphor for stepping out of the frame, finding perspective in midst of the challenging situation. On the balcony, the leader is momentarily away from the noise and activity and chaos of situation, allowing him or her to gain a clearer view of the reality. And this while we are in the lockdown situation, many of us are also thinking about the solutions to the different expected problems. So this is a kind of balcony, get to the balcony behavior that you are an example in a place where you can focus on your own intuition and try to get the solution while interacting with your own self. For example, a chief of union negotiator who is the midst of the difficult labor talks step away from the table for a moment to separate from the emotions and intensity and reflect on the goals of the talks. Once this leader feels she gain as a grace for the issue at hand, she dives directly back into negotiation. So many times the leaders may withdraw from the meeting for some time, and he or she may sit in the office or maybe with 1 or 2 friends to further deliberate on the issue and then step again into the meeting or negotiation to tell the people the big picture perspective. The second is to identify the adoptive challenges. These can be, for example, 4 types of adoptive challenges one can. For example, if another company buys the manufacturing facility and the new owner implement production procedures and standards that the facility workers are unfamiliar. So this can be adoptive challenge. For example, a small company has been owned or acquired by a bigger company which is having a very different environment and environmental challenges. Then definitely for the old company or small company, it would be difficult to adopt to such challenges. So the first approach is a gap between espoused values and behaviors, that there might be a gap in the behavior and values of the two, and then competing commitments. When the organization as numerous commitments and some come into conflict with each other. So the first situation is that there might be value and behavior difference between the two. The second is that at one time you might be having a lot of commitments and competitions, and you may be coming up to, for example, at present circumstances, the government is definitely in a competing commitments. The first commitment with the government is to save the life of people and to provide the healthcare facility in a timely manner. At the same time, be ready for the worst situation in case the healthcare emergency is increasing. The third is a challenge which the government is facing at the moment is to help those who don't have their salaried income and who are working on daily wage, the middle class people, the lower class, poor class people, who are the workers, the middle level managers, the medium enterprises, and all these are definitely. So how the government can approach the poor people, the daily wagers, and how the government can bring some economic packages to help the medium and the small enterprises. This is another very high commitment. And the biggest commitment is to revive the economic growth once this COVID-19 is over, because we are expecting that the global impact of this pandemic is about 4 to 5% minus. Some optimistic estimates are -2%, and some pessimistic estimates are 5% a decline in the world global production. In Pakistan, we are feeling, and the IMF says that we will have a minus growth rate of 1.5% this year. And certainly, once the government is recovered from this COVID-19, this will be a great challenge for the government that apart from all other competing commitments, they have to come out of this financial crisis. The other situation can be speaking the unspeakable. The sacred cow and elephant in the room are example of this archetype. For example, you may not be in some time allowed to speak against the leaders. And finally, work avoidance that the people, maybe you have a very good innovative idea sometime, but the sacred cow may not allow you to speak. Or maybe sometime you see that a very unsuitable person may be sitting in a role or, in which he or she is not capable to do justice to their position. That is just like elephant in the room or a bull in the china shop. Is a very common metaphors. And then work avoidance can be another situation in which the people would not like to move out of their comfort zone, and they would resist and they would deny to bring any change by the leadership in the organization and systems. And that is one of the biggest adoptive challenges. Now, the stress would definitely become once the changes. You might have seen that even in the COVID-19, we are witnessing a great deal of psychological distress in the people in terms of losing their jobs, in terms of losing their work, in terms of delay in the schooling of their children, in terms of reduction in their incomes, and again, the social depression by through the isolation at home, when social distancing itself has brought a lot of psychological challenges to the human beings. So this would definitely bring a lot of distress to the people at different level, and it would be a biggest challenge with the leaders to regulate this distress. Now, for this, definitely they would try to create a holding environment in which the people would be helping each other, provide direction, protection, orientation, conflict management, productive norms, providing direction. So while working with the change management team and bringing the capturing the adoptive challenges, certainly the leaders would be providing direction, clear direction and focus to the team. They will protect them from any kind of problem. For example, the people who are working at the front line healthcare workers, they are faced with the challenge to avoid their contact with the coronavirus and their infection with the coronavirus. We could see that in Europe, in America, and even in Pakistan, there has been a large number of the healthcare workers have been victim of this COVID-19, and they have been exposed to the situation in which they have contact with the coronavirus infections, and unfortunately, many of them have become victim of this COVID, and a big number of the doctors have died because of this infection in Italy, in UK, in America, and even in Pakistan. So this would need that the leaders should provide a protection to the people who are working at the front line to bring their change, their orientation, their training and development. Definitely, they would be succumb to different kind of pressures. Conflict management, there will be conflicts in the roles, in the authorities, and the protections even. And the leaders would try to, there would be conflicts at different tiers of the workers who are working at the front line. And then you would definitely develop the SOPs, you would develop the standard procedure which can protect the people and which can ensure the high productivity. And so I'll not go into details, but definitely you have to do as a leader, and the COVID-19 and its tackling by the healthcare facilities is one of the biggest, good example for the adaptive and regulated distress. The personal stress is another very big issue, because the people who are exposed to such kind of stresses will have different kinds of response. Some of them will be definitely understanding and also regulating them by themselves, but maybe some of them are in a high distress position, and they would definitely need to have the high level of mentoring and counseling. Disciplined attention. This means that the leaders need to encourage people to focus on tough work they need to do. This does not come easily. People naturally do not want to confront change, particularly when it's related to changing their belief, values, and behaviors. And again, the COVID-19 and working within the COVID-19 and working with the patients can be one of the examples that people may avoid to be in contact with them. They may go to the strikes. They may not come to the to attend the patients. And so for that, you need to have a very high level of motivation. You could see that the whole nation in the world has been paying their high tribute to the health workers, the frontline health workers, to motivate them, because they are the people who are working and fighting against this menace of the COVID-19 at front line. People can ignore the problem, blame the problem on the authority, blame the workers, take those who want to address the problem. So there might be some politics coming up. Some people would blame each other. Some people may abstain from work. Some people may even withdraw from work, and some people may be blaming each other. So in this kind of situation, definitely the leader would try to bring the attention to the disciplined outcome by the people and to create a motivation through which they can deliver. So the people in general would like to abstain from the work by different contexts, and it would be the responsibility of the leader to take them back to the work. Override directive leadership can result in people being dependent on the leaders and inhibit them from being adoptive. So if the leadership is more directive and they're not allowing the people to develop their own innovative solutions, then definitely the people would be coming back to the leaders and ask their solutions. Leaders need to be aware of and of monitor impact they have on others, giving work back to the people. So this is very important, that you enable and empower your followers to give them enough authority so that they can handle the work, provided they have the capacity, but definitely you need to develop their capacity. There can be a fine line. Leaders have to provide directions, but they also have to say, this is your work, how do you think you want to handle it? This is very important, that you all the time provide them your direction and your guidance, but at the same time, it's also very important to handle them so that they can also be adopted. For adoptive leaders, giving works back to the people means empowering people to decide what to do in circumstances where they feel uncertain, expressing belief in their ability to solve their own problems, and encouraging them to think to themselves rather than thinking for them. Protect leadership voices from below. This is another very unfortunate scene, that many people, non-leader people who are kind of pseudo leaders or quasi leaders, may try to become the leaders out of this situation, and they may try to play their politics and their unionism and all these. So in this particular case, the leaders have to be really very careful. The adoptive leader has to be cautious to listen and open the ideas of people who may be at the fringe, marginalized, and even deviant in the group of organization. For example, we could see that in the healthcare frontline workers, we could see the grievance of the nurses, the people who are cleaning the hospitals and healthcare centers. So they were also having a lot of voices for their protection. This is a challenge because when the leaders give voice to an out group, it's upsetting the social equilibrium of the group. So you have to be very careful. You have to listen very carefully to all, but you would not allow the people to become leaders in a sense that they create problem for the leaders. Adoptive work is the process towards which adoptive leaders direct their work, is the focus and intended goal of adoptive leadership. Adoptive work develops from the communication process that occurs between the leader and the follower, but it's primarily the work of the follower. So you basically enable the people around, and you enable them to do the work, and the people and your followers will bring the solutions, but certainly the leadership would play its role. It occurs within a holding environment where people can feel safe and they confront possible changes in their roles, priorities, and values. Now, I think we can have a. Okay, thank you very much. We had just a small break of Maghrib prayers. I'm sorry. Now, coming back to the adoptive leadership, we see that how does this theory works. I think the biggest application and implementation or use of this theory can be the modern dynamic challenges, and we could see this is one of the biggest challenge in the healthcare, because in case of emergencies, in case of endemics and pandemics, and we can see that there are a lot of challenges to the healthcare workers. So the leaders take time to step back from the challenge situation to understand the complexity of the situation and obtain a fuller picture of other interpersonal dynamics occurring among the participants. So this is very common in the adoptive challenges, that the leader would certainly find time and may isolate themselves from the problem for some time to see the full bigger picture. Second, in any situation or context where people are experiencing change, the leader first makes an assessment to determine if the change creates the challenges that are technical and adaptive in nature. So easily you can identify, for example, when we were transforming for this online education, we could see that there are problems of both the technical, adaptive, and then purely adaptive problems. And we had to segregate or separate the problems in the three different sets, and then deal with the problems in a way it can be solved. And definitely we, for adaptive challenges, we also involve the external stakeholders, we involve the experts from within, some good mid-level leaders. If challenges are adaptive, for example, if the challenges are technical, the leader addresses the problem with his or her authority or expertise through the rules and procedures. This is very common. And then the challenges are adopted, the leader engages several specific leader behaviors. So within himself or herself, and maybe with the help of other leaders, they would try to bring some innovative solutions. Adaptive leadership incorporates many of these behaviors simultaneously and interdependently, with some of them more important at the beginning of the process and other at the end. So that would depend on the nature of challenge, but certainly the adaptive leader would use different blends of these approaches. Overall, it is safe to say that adaptive leadership works because leaders are willing to engage in all these behaviors with the intentions of helping. So it's very important that the leaders would come up with the different kind and behaviors through which they can bring the required change within the organization. Now, the first strength of this leadership theory is that it takes a process approach of the leadership. This approach emphasizes that phenomenon of the leadership is a complex interactive process comprising multiple dimension activities, and it's not only the attributes or traits of the leaders are important, rather it's a process which is a complex process, and the leaders have to understand the dynamics of this complex process. Secondly, adaptive leadership stands out because it is follower-centered. Adaptive leaders mobilize people to engage the adaptive work, and this again is that the whole emphasis of the leaders would be to develop their followers, the team workers, so that they can bring the desired change. And the third is adaptive leadership is unique in how it directs attention to the use of leadership to help the follower deal with conflict values that emerge in changing work environment and social context. Change and learning are inherent in the organization life. And adaptive leadership focus specifically on helping followers to confront change and examine the emergence of new values that may accompany change. So this is really very important in the adoptive challenges, in the challenges where we believe that there will be conflicts of values, there will be conflicts of rules and regulations, and there will be conflicts on the roads. So in all these circumstances, we believe that the adoptive leadership would play to bring the consensus about these conflicts. Another strength of adoptive leadership is that it provides a prescriptive approach. That it come up with a prescription, a recipe to solve the problem, and the problem may be of different natures. So you cannot use the same recipe or prescription for all problems. So the leaders would try to understand the nature of each and every problem and bring the solution as per the need of that particular challenge. It suggests that followers should learn to adapt and leaders should set up a context where this is most likely to occur. So for each follower, for each problem, you will have to bring a specific prescription. Again, there are criticism. First of all, that since the theory is not very old, or the two and a half decades, so therefore it's very little literature is available. Because first it was published by Reeves in 1994, and since then almost 2.5 decades or 3 decades most, there is little work available to see the use of this theory in the empirical evidence is lacking. Major factor in adoptive process in these factors relate to one another to facilitate is not clearly delineated. So there is a theory is given, but how far one impact the other one is not delineated. Now, adaptive leaders can be criticized for being too wide-ranging and abstract. So you don't give a very clear-cut model. Rather, it is having a very large list of behaviors. Finally, from a theoretical perspective, adaptive leadership hints aid but does not directly explain how adaptive leadership incorporate a moral dimensions. Adaptive leadership focuses on how people evolve and grow through change. The model acknowledges the importance of promoting values such as equality, justice, community, but the link between adaptive work and achieving these social values is not clear. And this again is the biggest challenge in this theory or this approach, that though some prescriptions have been advised, but how these prescriptions are addressing the challenges is not given, and there is no empirical evidence existing. Now, but still, despite of all this criticism, the adaptive leadership theory is still widely applied. And I have already described that it is most commonly applied in the healthcare services, where the technical versus adaptive and strategies for managing them, a holding environment is very common in such kind of environment. On the organizational level, adaptive leaders can be used as a model to explain and address a variety of challenges. At this point in development of adaptive leadership, the context in which most of the research has been conducted is healthcare. And I already submitted that most of the research which has been done by using the adaptive leadership has been done in the healthcare and hospitals management. And the reason is that the challenges we are having in the healthcare sector are very innovative, very adoptive challenges come. We don't have off-the-shelf solutions. And we could see this in the pandemic of COVID-19, that there has been a large list of the adoptive challenges. In summary, there are many applications for adoptive leadership, both in person and organization level, as well as in the research environment. While further research needs to be done to support the tenets of the adoptive leadership, it is clearly a leadership approach that can be utilized in many ways. So you can go to some of these videos and can find some of the further reading material. the transformational versus adaptive leader. Uh, so thank you very much. I think this was enough for today, and this was more or less about the adaptive leadership. And next time, viewers, we would be listening to the more important team leadership. So thank you very much, which basically greenleaf theory, and we will discuss this in the team leadership. Thank you very much and have a nice time, and Allah subhanahu wa ta'ala bless you and us all with good health, with the protection from COVID-19, and let the whole humanity is protected from this menace of the COVID-19. And we pray that the normalcy come back in the world, in Pakistan, in the Gilgit-Baltistan, and we are back to work, and we are once again happily working with our colleagues and students and staff. Thank you very much, and may Allah subhanahu wa ta'ala bless us all. Ameen.